The Presidential Taskforce on Human Resources for Health now wants Parliament to consolidate various laws that inhibit the implementation of universal health coverage. The task force, chaired by Professor Khama Rogo, while engaging the National Assembly Health Committee on challenges facing the health sector and required interventions, also indicated that the country lacks data on health care. Here's that report.
The meeting between the Presidential Taskforce on Human Resources for Health and the National Assembly Health Committee identified frequent unrest, conflicting laws, and inaccurate data as key challenges affecting the implementation of universal health coverage.
Cancer right now is looking for 5 billion for them to restart because of what they bought and is expiring in the stores there. We've met Khama. Khama has a budget of 10 billion a year. We only give them 2.7. The other 7 billion is donor money. So they are not doing our research. They're doing somebody else's research.
The task force chairperson, Professor Khama Rogo, asked members of Parliament to consolidate various laws to guide the health sector.
So whenever you have a bill coming up to address a certain issue, we would just like you to coordinate with the Ministry of Health and other stakeholders in this sector so that we are not replicating what another act is providing for.
The task force also asked MPs to look into the working relationship between the two principal secretaries in the Ministry of Health. The task force, gazetted by President William Ruto in July last year to provide strategic guidance, found out that the country has no data on the total number of healthcare workers in the country.
Health data, national health data, that is housed by foreigners. It is housed in servers, it is housed in the cloud or wherever else by people who are not Kenyan. They are donors. So how do we address this issue of data? How do we address the fact that we have such disjointed data across the country? We do not understand how many health workers we have, how many are being produced, and no one single source can give us substantive information about our health data.
The issue of lack of data on health providers comes at a time when the country has been reporting numerous strikes among health workers. The task force, however, maintains some of the demands in collective bargaining agreements are unclear and hence cannot be acted on. Gishoke Washira, Prime Edition.